Thank you. Again, good morning and welcome everyone to the Coalition of Orange County Community Health Centers Coffee Connections event. It's wonderful to have you here today, especially because it's our first in-person Coffee Connections event of 2024. We've had them for the past 2 years and they've all been virtual, so thank you so much for filling the room. My name is Isabel Becerra, President and CEO of the Coalition of Orange County Community Health Centers, and I'm honored to host today's important dialogue on the future of healthcare in a post-election landscape. For those of you who are new to joining any coalition event, thank you so much for being here, but I want to tell you a little about the coalition. We are a membership organization that represents the interests of community health centers in Orange County and who serve our most vulnerable populations and community. Today, we represent 20 community health centers and 1 community-based organization. Those community health centers that we represent operate over 70 locations across the county. They provide over 1 million visits to almost 300,000 patients. And I see many of our members here today, so thank you so much for being here as well, taking time out of your busy schedules. Our Coffee Connections events were designed to be a space where we come together as a community to explore critical health topics, exchange ideas, and inspire action. This is our final Coffee Connections for the year, and what better way to close out 2024 than by focusing on the future of healthcare, again in a post-election landscape. The results of 2024 election will undoubtedly shape the future of healthcare at the federal, at the state, and at the local level. We find ourselves at a pivotal moment, from potential shifts in policy and funding to evolving healthcare priorities. It is both a time of uncertainty and profound responsibility. The road ahead is undeniably challenging, with many in our community and across public health grappling with fears about what lies ahead. The outcomes of this election weigh heavily on all of us, shaping everything from access to care to the resources available for our most vulnerable populations. And yet, this is also a great opportunity for all of us to do what we do best when we come together. While the implications of the election may not be readily visible and still unfolding, this is really a time for us to reflect, to strategize, and prepare to navigate this evolving landscape. And as healthcare leaders and community, we have the unique ability to drive change together. I had a conversation earlier today about the difference that 2020 has made in our work, from what we were doing before to what we're doing now. I think prior to the pandemic, we were all very respectful partners. We knew of each other. We knew the great work that we all did. But there was a little bit of friendly competition, right? Because funding and resources are limited, and so we were always pursuing similar paths and avenues. I think the pandemic forced us to realize that we cannot do what we do alone, and we need each other to do the collective work that we do and align our mission. So I don't know that there's ever that we can go back to what we were doing before, and why there's so much synergy and energy in what we're doing, again, together collectively. And so today's discussion will focus on how we remain agile, proactive, and united in the face of these changes. Our expert panelist will provide a post-election analysis, offering insights into the opportunities and challenges ahead. We'll examine the critical issues likely to shape healthcare policy, such as healthcare coverage, immigration, and reproductive health, and discuss how organizations like ours can adapt to meeting the evolving needs of our communities. And while the challenges are real and significant, so too is the strength we find in the collaboration and innovation within ourselves. This is the opportunity before us. We're going to come together, we're going to harness our collective expertise and ensure that our healthcare systems remain strong, equitable, and responsive, and that our communities are safe and able to serve and access all services that are available. Some of you may be here today looking for the answers to all of your worst fears, and although we won't have those answers today, we do have the power to advocate, to forge stronger partnerships, and build pathways that address the needs of those that we serve. Together we can rise in the moment and chart a course forward. So thank you again for your commitment, for being here today with us, for the work that you do every day to support our collective communities. And I encourage each of you to lean into this conversation, share your perspectives, listen deeply. I saw a lot of that going on earlier. And think about the ways we can collectively drive progress, because it is through collaboration and adaptability and shared commitment to health equity that we will push through these challenging times. So before we begin today's discussion, let me share a few key reminders. Please keep our conversations professional and respectful. Let's avoid offensive, discriminatory, or disruptive behavior. We are committed to fostering a safe and inclusive environment. Inappropriate comments or behavior will not be tolerated. We will take necessary actions if issues arise. At your table, you will find blank note cards and pens. As the presentations unfold, we encourage you to write down any questions that come to mind. And during the Q&A session, simply raise your hand and a microphone will be brought to you, allowing you to ask your questions directly to the panel that we'll be bringing up. And this approach ensures that we capture a wide range of perspectives while keeping the discussion focused, dynamic, and engaging. We will be recording today's event to share broadly with others. All Coffee Connection recordings are available in our YouTube channel. A little bit of housekeeping rules or items. If you have parked on site and require a parking voucher, please visit the registration desk to my right to collect a voucher before you leave. And again, finally, we value your thoughts and feedback, and at the end of today's event, we'll have a brief survey for you to complete, accessible via a QR code, and simply scan the code, share your insights, and we'll be happy to receive it. Your input is essential in helping us improve and shape the future connections or coffee connections that we'll have throughout the future. And again, we greatly appreciate your time. And with that said, let's go ahead and get started. It is my honor to introduce our keynote speaker, Francisco Silva, President and CEO of the California Primary Care Association, CPCA. CPCA represents more than 1,200 nonprofit community health centers across California, providing care to millions of individuals and families. These health centers are the backbone of our healthcare safety net, and under Francisco's leadership, CPCA continues to champion policies and programs that ensure access to quality care for all Californians. Francisco's journey is as inspiring as his leadership. Born in Mexico, he has a bachelor's degree from Santa Clara University, a law degree from the UCLA School of Law, and an MBA from the USC Marshall School of Business. His unique combination of legal, business, and policy expertise makes him a dynamic leader in shaping the future of community health. Please join me in welcoming Francisco Silva to kick off today's discussion.
Good morning. Buenos dias. All right, let's try that again in English again. Good morning.
Good morning.
I love that. First of all, Isabel, thank you for the invitation and for the community health centers in this room and the members of CPCA. Thank you for your engagement. I know we're in a moment in time where there's a lot of anxiety and concern about the presidential election and what that means for healthcare. One of the things that I think we need to do in this moment in time is really think about our strategy. Think about how are we going to organize for success. So my roadmap for today is to first think about what's our mission, what's our vision. It's a time to remember why we do the work that we do, and I'll get into that in some detail. Then our strategic approach to what's coming next, how we're going to organize for success, really identify the potential challenges, but not stay there, right? I've been in rooms since the election where when you start putting the challenges on the board, guess what happens? We all get anxious, stomach turns. But it's important to identify the potential challenges that we may face, and then we'll talk about potential opportunities, because there may be some there. And then we'll talk about the tactical priorities, and I think it'll fit really well with the rest of the conversation today in terms of different pieces where there's concerns, but also opportunity, and then what tactics should we all adopt? Because we got to do it together, like Isabel said. So now first with, what are we solving for? And who are we? For CPCA, it's important for us to think about that, to keep us really focused, because the potential challenges are so broad, right? And for it not to feel overwhelming is to realize this is the piece that we're really good at. This is our strength and this is our mission. And know that we're going to do it in partnership. And there are other partners that we work with in community, that they have a different strength and a different mission. And together we can be really strong and tackle what appears to be really broad. For CPCA, our mission is to support and serve our community health centers and our regional associations in their mission. The way we do it is through education, convenience, technical assistance, advocacy, which includes lobbying, litigation, public affairs. That's what we do really well. And for our health centers, right, you're in the community. You provide not beyond medical care, right? It's everything else that engages in the community. There's a service component to that, but there's also an education component. You're a trusted source for the community, and we've got to keep that in mind as we think about this, right? And how to address the challenges. That's really critical. So with that in mind, here's our strategic approach as we think about the challenges. There'll be times where we're going to lead, where CPCA or where our health center or where our community-based partners, where it makes sense to lead, that we're going to get in front of a particular issue through advocacy, whether it be through education, but we're leading. But in this moment in time, there may be times where we support that we might not be in the position to lead, that we should support. And there may be times where we should stay quiet. And I'll dig into that once we get into some of the issues. Because I told Jonathan I was going to quote him. And I might get the quote wrong. But the essence of it, do you want to win or do you want to be loud? Do you want to have success or do you want to be loud? And there might be instances in this environment where the most important thing is caring for our community. I think of immigration that way. And we'll talk about immigration in a bit, where we're going to be strategic. Some will have to be loud. Others may have to be in the background quietly protecting and caring for the community. And others may have to educate. It's going to have to be that kind of dynamic as we move forward in this environment. Potential challenges. And this is big, right? And I do want to look at it because I think it's important to keep in mind our approach to it is to look at it and identify many of the issues. And this is not exhaustive, but it looks exhaustive. And to not have a knee-jerk reaction to say, prioritize. You can't do it all, so only do 3. We're not looking at it that way. The way we're looking at it is, what are the places on this map where we need to lead? Where are the places where you have to identify somebody else that can lead and we can follow and support? And think about it that way, again, in coalition and collaboration. The optimism in this is that you've done it before. I've been at CPCA now for 2.5 years. I've made it a priority to go out and visit as many of you as I can. I still have a lot of work to do. I'm to about 48, but we have about 180. So I got work to do. And that's not accounting 1,300 sites. But when you look at health centers and the community-based groups that are here, you were created to fill a need that wasn't being met, right? It was activists, it was providers, it was people in government, you name it, stood up to care for a community that wasn't being cared for. So we've done it before, we know how to do it. But you look at some of the challenges that we're looking at. When you look at health centers themselves and the potential funding, there's concern about our 330 grant. Our funding's up for refunding as we speak, and there's concern that it may be challenged. There's a report that came out, the Paragon report, that is one of the think tanks for the more conservative, right-leaning electeds that said, well, they shouldn't fund them. So we're concerned. It's something that we're prioritizing and looking at. All the workforce dollars, the teaching health center programs, GME, we're concerned about that. SNAP, we're concerned about that. Our PPS model, we're concerned about that. Title X, we're concerned about how it can be impacted. Ryan White, we're concerned about that. WIC, we're concerned about that. So the core funding for health centers and all the other programs that are important in our community, we're worried about. And then if you look at other programs that are really important, 340B, immigration, of course, the MCO tax. Who's heard of Prop 35? Raise your hand if you have. It just passed. It has the potential to infuse $10 billion into the healthcare system that has to be spent in healthcare, mostly all in Medi-Cal. It's done through a provider tax. So there's concern that the provider tax funding mechanism, which draws down more federal money, that's the way it works, that it might be challenged in this new administration. So this huge opportunity for Medi-Cal in California, we're worried about not being, it being jeopardized. PCA funding, we're a primary care association. Like the health centers, we have our own version of a 330 grant to do education and technical assistance, including our regional associations in the state, and we're worried about that in this new environment. And then I'll touch on Medicaid, right? Medicaid, there's potential threats. If they do a block grant, that could really change the landscape for our funding and threaten it. If they change the FMAP is the state puts money in Medi-Cal and draws down a federal match. And for expansion, the federal match, we got a lot more federal money than the state money that you put in. And there's a lot of concern that those ratios are going to change, which means less money to the state. And as many of you have read, the state's in a deficit environment. It got better. It was in the high 20s, low $30 billion deficit for California. The estimate now is somewhere between $2 and $4 billion, but it's still a deficit environment. So there's a lot of concern even in California about potential cuts to healthcare and social services. So yes, I said I wasn't going to give you anxiety, but it is important for us to be concerned, to pay attention to it, to draw the map. And if there's something on this map that you know about that impacts you, we should put it on the map. It shouldn't be, well, then it becomes too comprehensive. There are definitely certain issues here that are more existential in terms of a threat, but they may show up in different time, or they might not even come to be. There's still a lot of unknowns. But these are the potential challenges that we're preparing. And part of our analysis is where do we lead? Where do we rely on others? For instance, for some of our core health center funding, NAC and other national associations are prioritizing and making it a priority. Let's partner with them and figure out what they need from us. There's also potential opportunities. Again, we don't know yet, but what we do know from past experiences with Republican administrations, including the Trump administration, and RFK Jr., there are certain issues, at least in prior practice, that they're open to, and there might be opportunity. Same day, so everything having to do with behavioral health and wellness and mental well-being, there's a track record there that it's a priority for them if you frame it the right way. So same day has been an issue for health centers, right, where we don't get paid if you provide medical, behavioral health on the same day. So there's potential there. Telehealth, right? In California, we did that work to make sure that if our patients get health care through telehealth means, including a telephone call, you get paid for that. But at the federal levels, it still keeps getting extended, right? Is there an opportunity there to make that permanent, particularly in the Medicare space? And then value-based care. It's an area that we're all leaning into. Some we call it the pyramid of success, the ability to draw down more of the healthcare dollars by doing value-based care, reporting on quality. It's a challenge, but also an opportunity in this environment. And there's some hope. And the hope is that healthcare, including Medicaid, that's changed in the last 15 years. 15 years ago, the thought was that if you go to voters and said, we want to tax you, or we're going to tax somebody to put more money in Medi-Cal, they're like, no way, you're crazy, right? The electorate will never support that because it was considered to be a program for someone else. That's not the case. And Prop 35 showed us this. The potential for healthcare to be a bipartisan issue. If you look at this map, the green is every county where Prop 35 passed. Only one county didn't pass it, and that's Lassen, and I think it failed like by 300 votes. And we spent no money or resources talking to those voters. The other thing in this effort, when we did our polling and focus grouping, so when you put something on the ballot, right, you poll the voters to figure out what kind of messaging works, and then you put people in a room and ask them questions. And one of the things that was very telling, there's something special there in healthcare, that regardless of party affiliation, whether you lean right or lean left, in the middle, it was something that was persuasive, that folks wanted to support. And when you look at the presidential election landscape, we saw that in other states. So it's not just the California dynamic. When framed right, from issues to reproductive rights to even abortion, you had some red states where the voters approved protecting abortion at the same time that they voted for President Trump. So healthcare framed the right way. There's opportunity. There's hope for us. And this is just to show a side-by-side, right? Red is where President-elect Trump won. Blue is with where Vice President Kamala Harris won. Compare that map to 35, right? So even in those communities where President-elect Trump won, voters voted for 35. And remember, it's a tax. It said tax on the actual ballot, but it also said Medi-Cal. And that's the other thing that I want to highlight. Who got to see the Dr. Chavez ad in this community? Thank you, Sibel. Well, Google it. I think it's still up. It was the primary ad the Prop 35 ran. And what's really important about the Dr. Chavez ad, it was a doctor who founded, is now the CEO of a community health center in LA. And it was a Medi-Cal message, purely a Medi-Cal message. And when we were going through the election, the campaign process, we run, the way it works is they run ads and then they poll afterwards to see if an ad's moving voters. At one point, we were running the more traditional invest in healthcare because ER wait times are too long and we have a crisis in access. We started with Chavez, which was Medi-Cal for everyone, and we saw it tick up support. We flipped to a message that was more focused, ER focused. We saw support go down. We flipped back to the Medi-Cal message, support went up. So that message is strong. And when you look on the right, I have the Orange County results, right? Prop 35 won overwhelmingly in Orange County. And I can't read it that well because my eyesight, 64%, 65%. The statewide was about 68%. And then you look at the presidential election, it was a lot tighter, right? So even in Orange County, the healthcare Medi-Cal message was more compelling in this community. Again, this is to re-emphasize we have to organize for success, lead, support, and follow, collaborate, coordinate, and then how are we organized structurally? So my advice to all of you, and we're doing this work internally, think about your teams, the resources that you have in the coalitions, to put them in the right place so you're at least identifying the challenges when they come in, and then don't feel overwhelmed. You have partners. We took that map that has all the potential challenges, and I have a person on my staff that's the lead for every one of those issues. We're here for you. So as a follow-up, if you have a question about any of that or you want to add something, please follow up with me. And because we have somebody who has expertise, and the goal for us is to connect, right? It may be that we're leading a particular issue. It may be that we're going to connect it to somebody else who's leading. Now, tactical considerations. You have to have a communication plan to inform. Our goal at CPCA is we're going to establish either a bi-weekly or a weekly. We'll see how it goes. During COVID, we had a weekly all-member gathering because information and things were going so fast. We don't know how quickly things are going to go, right? They may go slow, they may go fast, depending on the particular issue. So we'll do weekly or bi-weekly. We're going to have a landing page on our CPCA website that has all the issues that we just covered to provide education and, again, connection. We also plan to coordinate, of course, with our regional associations to make sure that that we're connected and engaged. Other tactical priorities for us. We need to think about our rural, Republican, and red state strategy. On some of these issues, for instance, on Medicaid and Medi-Cal expansion, Medicaid expansion, there are many red states now that have done the same that we've done. They've expanded Medi-Cal. Any change to their version of Medi-Cal. They've expanded coverage. The ratio in the FMAP in terms of funding is critical to them. If that is changed, it'll be devastating to them from a budget perspective also. So in this environment, in some of the situations, back to my example of when you lead and when you support and when you stay quiet, if there's a threat to Medicaid expansion, it may be best strategically to rely on our red state partners. And we have community health centers there that are beloved. And we stay quiet. If that's what we have to do to succeed, or we support, or we, depending on the dynamics, right? So we got to think about it that way. In California, there's opportunity here in Orange County, right? And I think Jonathan's going to dig into this, right? But there's real opportunity here in terms of your delegation to Congress, because you do have Democrats and Republicans that have a voice, and we have to rely on them. And then we have areas of our state that are very rural, that look like the South and the Midwest and red parts of this country. And our health centers and our community-based partners are essential for those communities. Indeed, in some of these communities, they are the only significant primary care provider in the whole area. You have areas of this state in the North and Central Valley. Our health centers are it. Private practice for primary care is almost gone. So we got to be strategic that way. And in California, even though California, we tend to think about it, at least in the national landscape, as being the super progressive left, we have other dynamics, as you know, in this state, that in this environment, we have to lean on, and maybe they lead, and that's the way we're thinking about it. We got to do a real relationship assessment. As you saw by the appointments, this really stuck out for me. As you saw the appointments that are being announced by the new administration, they're not your traditional folks that are in politics. So even in the room, in the room with some of the folks at the national level that I've been in since the election, the states where historically have been mostly Republican, they're having to do the same. They're like, well, usually we'd have some kind of connection with the new administration if it's a Republican administration, but it's so out of the norm that we're going to have to think about who do we know. And it tends to be, it looks like folks on TV. So if you know folks on TV that have connection, let's find them. We got to think about that way, right? Whatever relationship that we have that can help us, we're doing that work. And we embrace you to do the same. Coalition. We have some wonderful coalition partners, like Chirla on immigration, that if we can support you, if there's times that you need us to lead, there are times you need us to be quiet and take care of the community, we're here. And I want to talk about immigration as my conclusion. The primary care associations in the state, we've come together and said, okay, let's all put our resources together and hire lobbyists in DC that can have access and impact with this new administration. And again, it's not ideological, it's how do we protect our communities, our health centers. If that's what it takes, that's what we'll do. We need information and data. This is really important. Back to my point about Medicaid and health being critical, it really is. If framed the right way, it can be effective. Even with this new administration, we have to be prepared to do that. We're preparing to litigate if we have to, but that may look different in this new environment. We have a different Supreme Court. We do have an Attorney General who's already indicated that he's prepared and getting ready to have the resources to do so. Leverage our Prop 36 coalition and public affairs campaign. Now, the other one is our civic engagement work. LA and Orange County in the last 2 years really dove into this space, which is developing the infrastructure, partnering with community, having health centers be a resource to make sure that we engage the public so they vote, so they engage civically. The idea behind it, of course, is that healthcare in the traditional healthcare environment only addresses about 20, 30% of people's healthcare needs and wellness needs. The rest are the social, political drivers of health, right? If we don't address everything else. So we've made it a priority that for our strategic pillar to really address health equity and health access is that you have to do the civic engagement work. I want to talk about immigration, and it's related to this. And first, when we talk about immigration, frankly, it sounds really dire. And I'd be remiss if I didn't mention it and engage in it. I'm an immigrant myself. Came in a multi-status family when I first got to this country. No tenía papeles myself, I didn't have papers, as we said back then. So I remember the day where it was very disruptive. The INS, which was the former to the Homeland Security, they would show up at grocery stores, at your place of work, even at your home. And I remember my sister and my brother-in-law bought a new house in a new community in Salinas, where I grew up. We're farm workers in my family. And they were doing work in the front lawn, and they showed up. Somebody called INS on them. And I give that just an example of how disruptive it can be, right? We have 22 million people in this country that live in a multi-status family. Right? A lot of people are thinking about, it's just them, the folks that might not have legal documentation. But the impact is much broader, right? It's those families, it's the places that they work, it's the communities, it's the places of worship, it's in our health centers. But we're not where we were when I was a kid, right? Our health centers have grown, our Our community-based groups have grown. We have the cheerless of the world that built these robust systems to protect, engage, and provide a safety for our community. Our civic engagement work, I think, presents a real opportunity for our health centers, right? It was built, the infrastructure we're trying to build was to educate and engage on the theory, and we know it's true now, that we're a trusted source to the community for information even, right? During these times is really knowing, not just immigration, but everything on that map. What's happening? What can I do? Is there other funding opportunities? Particularly in our community, I think we, in partnership with others, and we were really careful in our civic engagement work to say we're here to supplement and support, not to replace, right? There's a lot of groups doing the work already, and I think largely we've been very effective. We can leverage that, right, to be that trusted source, that education, and if necessary, that leader in advocacy is strategic. So I wanted to leave you with that message that there's a strategy there. We're organizing for success, and you're not alone. Next steps for CPCA, the board's going to do their policy prioritization for this year, and then we're going to go and retreat. And part of our objective in our strategic retreat is going to be exactly where I started. Where do we lead? Where do we support? Where do we collaborate? Ultimately, to protect our health centers so you can provide support to your patients and your community. Thank you very much.
Thank you, Francisco, for that insightful and thoughtful keynote. You're absolutely right. We're not in the 90s anymore, but I think the trauma that some of us shared still follows us, right? And so that's why it's so important for us to continue to work together in the way that we have. And I am so glad to have you, that we, Californians and community health centers specifically, have you at the helm at CPCA. So deeply appreciate that. And I also want to stress that our Orange County community also has us, right? So I am on the board of CPCA as well. I am on the board of our local health plan. I'm just elected chair again yesterday, thankfully. And so there's a lot of, there's a lot that we can do at the local level as well with our local resources. I also participate on the board of the Latino Coalition for Healthy California and members of the National Association of Community Health Centers. So we're coming at it from all fronts. And it's, again, so great to be amongst friends working together to address, the barriers and the issues we're facing today. So I'm going to ask now our panelists to come up so that we can have you introduce yourselves and we can get right down into the discussion. So Jonathan, Karen, Betty.
Hi, everyone. I'm John Friedman. I'm with a consulting firm called Health Management Associates, work in the publicly financed health space. I have a long background, a brief 39 years in the California safety net, worked for Los Angeles County for a very long time in LA Care. And I work with a lot of safety net entities throughout the state, public plans, FQHCs, county governments, et cetera. It's great to be able to see so many people in the room today. Thanks.
Good morning, everyone. I am all of a sudden slightly nervous to be up here with all of you. It's so wonderful. My name is Betty Limon. I'm an emergency room nurse. I started 30 years ago in the HIV/AIDS space, doing a lot of work in the Latino LGBT community. So I did a 20-year hiatus and just surviving, living in DC and Orange County, and I'm back and I'm doing it on the front lines as a nurse. So I welcome bringing that perspective to all of you. Thank you so much for joining us this morning.
Good morning. Can you all hear me? Oh, okay. It's like I can't hear myself. Good morning, Dr. Nomsa Kalfani. I go by Nomsa or Dr. K or Dr. Nomsa. Co-CEO at Essential Access Health. So I will be bringing you information about Title X, what's impacting sexual and reproductive health. I come from federally qualified health centers for 10 years doing operations and programs, and actually want to bring in the sunny side, because I know it feels like there's like doom and gloom, because there is doom and gloom, but also wanting us to also just try to find that light at the end and kind of strive and harness, as Isabel said earlier, the opportunities for the state that we are in.
Thank you. Oh, you have your own.
Yes. Hello, everyone. My name is Karen Hernandez. In LA, I go by Karen, but in South Orange County, I go by Karen. I'm a community educator in Orange County. I focus a lot of my work in South Orange County, given the legal deserts and all sorts of things down there. And I am with CHIRLA, which is the Coalition for Humane Immigrant Rights. We dropped the LA, but to be more inclusive, but it was Los Angeles. But our headquarters is in LA. That's where our biggest office is. But we do have 2 offices in Orange County and all throughout the state. And I'll talk a little bit about that more as we continue the conversation. So thank you and good morning. Thank you for being here.
Y'all have heard from me already.
And you all heard from me as well. So thank you for those thoughtful introductions. We're going to hear first from Jonathan Friedman, who's going to do a policy analysis, again, of what's to come or what he can see from his landscape and vantage point.
Thank you. Thank you, Isabel. It's great to see you. Isabel and I were chatting before the session, and I said, well, 20 years ago, how many people would have been in this room? 6, maybe, something like that. None. So kudos to the coalition. Kudos to all of you for being engaged. Now's not the time to tune out. I know there's an impulse to want to turn off the news, and we're frustrated and we're wounded and we're all this. Now's not the time to do that here. And as Francisco shared, we have to inform ourselves and we have to activate our muscles, all of our muscles here, about we're in a big fight. In order to move into a level of details here, I just tried to put together some slides that kind of frame for you what's at risk. What are we talking about here? I'm going to briefly touch on a federal outlook and then a California outlook, because we're playing in 2 dimensions in this environment. Briefly, there isn't a lot that we know. We actually know. There's a lot of talk, but what do we actually know that's going to happen in Washington, D.C.? What we know is that for at least 2 years, there is full Republican control of the White House and the Congress here. And what we know is that unlike Trump 1, Trump 2 will hit the ground running. So there was a period in the first Trump administration of a year of confusion and impulse and what's going on and so forth. That's not happening this cycle. There's far more organization and far more intentionality going on in the new administration. And we actually don't know how much health care is on the agenda, but we do know in a series of priorities, there's taxes in the economy, immigration and border security, and crime and public safety. Those are stated, known priority areas for both the Trump administration and the Republican leadership in Congress. What is to be known is how much health care is on the agenda. Okay? We don't know what is the impact of reshaping the role of federal agencies. What does RFK Jr., the nominee for HHS, and the MAHA movement, not the MAGA movement, but the MAHA movement, which is Make America Healthy Again, that's a constellation of parties at the extreme are anti-vaccination and anti-science, but there are also just different alternative views in this constellation of parties that there should be less government regulation in health, or there should be alternative points of view in the health establishment, et cetera. We don't know what the reshaping of the role of federal agencies in. We don't know what the impact of the margins, meaning the majorities of the Republicans in the Senate and particularly in the House. The House has actually gotten very tight. There's only a 5-vote difference in control, and that opens a very important strategy for us in California because we're not well positioned in the Senate here. And then Namsa and I have actually been talking about this as well. The impact of recent Supreme Court decisions, unlike 2016, we've calibrated against a certain type of Supreme Court. We have a very different Supreme Court today. So what the legal strategies are and the relative success of all of that is very, very different. And there is something called the Chevron decision, which basically weakens the influence of the bureaucracy in regulatory fights. There used to be a deference paid to the scientists in the EPA on interpreting a rule. And the Chevron decision of the Supreme Court actually just recently weakened that. So the scientist doesn't have a higher status than any other actor in a dispute here. So there's a lot to be known. And so this is why I'm saying it's not the time to tune out. This is the time for you to tune in, okay? And as much as it's difficult, you have to tune in. There are tens of thousands of people relying on you in this community. You have to be informed about what's going on here. And I also want to separate, before I get in the next slide, there's the 24-hour news cycle and X and social media, and there's that layer. You need to move down a layer, okay? And you have to follow this. A lot of things that are going to be talked about, they don't sit well with me. I'm a longtime practitioner in this space. But you like those pictures that have the fishes and the birds? You know, you see those fishes, and some people see both, and some people only see the fishes, and some people only see the birds. I'm going to say this, it may not sit well with you. There are serious thinkers on the right who think about health policy. And you have to understand the way they're looking at things in order to effectively counteract or negotiate or fight their ideas. It can't just be an outrage. I'm outraged like that. You have to understand this. Some of the things are in play here are how big and how wide the safety net should be. Should we condition public benefits on certain things? That's the debate that's going on that we're emerging in here. So in the Trump administration, independent of Congress at this juncture, there may be an effort to rework prior waiver deals to impose things like work requirements, which I'll touch on later on a later slide here. So you want to say what's immediately at risk in California? Could the Trump administration reopen California's waiver? Yes, they could. We're not entitled to a waiver. A Trump administration could reopen it. They could find a way to reopen it, and they could say, well, we'll only continue it if California if you do X, Y, and Z. Okay? The health-related social needs, things that we call CalAIM ideas, and the justice involved is just starting to roll out in the counties. This is the pre-release coverage here. Those will likely continue, but they may be tinkered with on the margins there. Tinkered with. Some things of CalAIM, feds may not like entirely, or the justice piece, maybe it's not 90 days, maybe it's 30 days, that type of thing. There may be some tinkering going on. But the real play is what's happening in the Congress. There will be an overall legislative package. It's called reconciliation. You're going to run into that term, reconciliation. Just think of it as a big legislative package to address changes in tax and entitlement programs. This is going to occur in the spring or summer of next year. This has to happen. Congress has to act because the Trump tax cuts expire on 12/31/2025. So in order for the IRS and for the Congress to tell people what taxes are like in 2026, you have to solve that problem in the summer next year. And along with that, there are likely going to be issues of how much does the federal government play in entitlement programs. So Medicaid reform is going to be on the table. I don't know this for sure. No one knows this for sure, except the crafters in the Senate Finance Committee. It's unlikely that there's a full repeal of the ACA Medicaid expansion. There's more likely there's a reform of the expansion. And the ACA expansion that we adopted in 2010 and implemented in 2014, it might add work requirements in things like premiums and copays. It may change benefit levels among eligible populations, more mixing and matching. TANF, CalWORKs beneficiaries get certain types of benefits, and Medicaid expansion, people get maybe a slimmer set of benefits here. Again, things that I don't agree with, you're likely to not agree. We have to understand these things in order to engage in them. And then, as Francisco mentioned, there might be adjusting in the federal sharing, the sharing ratio called FMAP, Federal Medical Assistance Percentage. Are there going to be changes in PPS to the FQs? Unlikely. It has broad support to the credit of their, but I'm going to point out a warning sign to you about this. Medicare, probably more Medicare Advantage, more managed care in that. Both the Trump administration and the Congress support those. Maybe even more benefits. Bernie Sanders has talked about adding dental and vision into Medicare, and there might be some coalition to do that in the Senate. The marketplaces, the exchange, we have a layer of enhanced subsidies in Cover California from the pandemic. Those are probably gone. But the underlying subsidies are probably not gone here. So right now, there's, for very low-income people who are just above Medi-Cal in California, there are a lot of zero-cost products in Cover California. That's unlikely to continue in 26 there because these enhanced subsidies are likely to go away. And then the thing you have to watch here, the appropriated programs, things that are funded in HRSA and SAMHSA and CDC, are there going to be reductions, and are there going to be policy and scope changes? There's a very strong desire to scope down CDC, as an example, to be much more narrower in focus. So that's what's on the table in Congress. We'll get these slides to you, but just what's at risk here? I just put together this chart. What could happen in Medicaid? Current law, benefits have to be uniform across the state. Under a future state, it could be like we're going to have flexibility. Different eligibles get different benefits. Work requirements, they're limited today. They might be broadly allowed. Premiums and cost sharing, they're generally prohibited in Medicaid today. It might be allowed. Waiting lists and caps, they're prohibited today, and they might be allowed. There are states that actually want this, by the way. And the financing, Francisco talks about, before the ACA, any population is paid for 50-50 by the state and feds in California, and the expansion is 90-10. This might get capped or turned into a block grant. And here's the worry, and this is why your delegation is very important here. Purple Orange County and the 5-vote majority in the House. Right now, as the Medi-Cal program costs more, anything costs less than healthcare year to year? Does anything cost less than healthcare? No. We're always trying to arrest the rate of growth, right? But right now under the program, as Medi-Cal costs increase, you're always sharing that cost with the feds, okay? Under a block grant, the state assumes the risk over whatever the federal limit is. And that's where PPS, if we have a block grant, PPS, I'm not sure a state wants that. We're going to lock in payments for certain providers, but you've locked in the federal money. So there could be a big fight over that, and that's something that CPCA is going to have to consider, and all the PCAs across the country about how to deal with this. And then let me just touch on work requirements. This is a sample of work status of people on Medicaid in 2021. The green bars are people that work full-time or work half-time. This purplish bar here is people who care for somebody. 61% of beneficiaries are working or caring for someone. So we might not like work requirements, but they might get forced on us, and then we have to figure out what's the best possible way to implement something like that there. It will cause people to lose coverage in California and as well as other states. California, briefly, the fiscal condition in the budget. Schools are still the priority. That's because of a Proposition 98 where we made schools the priority in California. Our fiscal condition is still soft, but the revenues are ahead of the budget here. That's good news for California. Healthcare. The Medi-Cal changes everything you're working on in Cal-AIM. They're still on track. But for now, we don't know. Okay? The next 6 months, we're going to learn a lot. Okay? Prop 35, great victory for the healthcare constituencies. We have a huge implementation challenge to make sure those dollars get to the spot. Francisco mentioned they could tinker with, it does still require federal approval here. And then the big question is, will California backfill federal losses? Do we even have the capacity to do that, to backfill federal losses? And then we have this big question mark here about what does it mean to fight Washington, D.C. there. You have to be, our impulse might be to fight and to litigate. But as I've mentioned about the Supreme Court, you have to be prepared for a result that you may not like. So you really have to think about how you fight, where you fight, and what does it mean if you lose there, because you might lose far more than you think that you're actually fighting for. That's why kind of being loud or being savvy is where we all have to activate our muscles here. Well, our instinct is to want to be loud, but we really got to activate all the other muscles that we have to be savvy in this environment. So look forward to questions.
Okay, so I'm going to start by asking all of our panelists, and I'll start this way to my right, Francisco. What do you see as the most urgent healthcare priorities following the recent election, and how should the delivery systems and community-based organizations position themselves to address these?
We always say, but no margin, no mission, no funding, no mission. So making sure that the resources are there is frankly priority number one. And addressing those challenges. And I think the way to do it, and I talked about that earlier, is it has to be strategic and coalition. I think if any organization, any provider or plan tries to do it on their own, I think it's too overwhelming. But if we do it in coalition, and I think Prop 35 is a good example of that. Ultimately, the coalition included the local plans, the health plans, from Cal Optima to the rest. So thank you for your support. And something unique, right? The hospitals, the private physicians and medical practices, the health centers, Planned Parenthood, and others came together when usually we were fighting for a little piece of the pie, right? And we agreed that let's grow the pie, and then we'll figure out how the resources should be allocated. And we all had risk there, right? And I think we got to approach it the same way. It's a different dynamic. It's about protecting what we have, but we got to come together. And I think the instinct may be for some to say, well, I got to go protect the resources for hospitals, or we got to go protect PPS and what's important for health centers. I don't think we should look at it that way. It has to be, we got to think about all the programs, right? From Title X to Ryan White to the core funding for us, and of course, Medicaid. So it's got to be in coalition, and it's got to be anchored in the community. We can't just look to like the national constituencies or the ones in Sacramento, statewide like us. It has to be anchored in community, because ultimately it's convincing the electeds and the policymakers to care for their community in whatever language is most effective, whether it's we talk in healthcare policy, like, or health equity in California. If we need to talk about health access, if that's most persuasive in this new environment, then we should, in community.
Thank you for that. Thank you for reminding us that at the end of the day, it all starts where we're at, right? And all policy and all politics are local at the end of the day. The relationships that the state and federal partner organizations rely on are the relationships that we have here at the local level. So thank you for that reminder. Karen?
Well, CHIRLA is a coalition for humane immigrant rights. We do immigrant rights work. Just to give a little background, we're the largest nonprofit doing immigrant rights work in California, arguably the country. California's a pro-immigrant state right now, but it wasn't always this way. Prop 187 happened in 1994. It actually started in Orange County. It was a woman in Orange County. I want to say Yerba Linda or Garden Grove, one of those cities. And she's called it Project SOS, Save Our State. Okay, and basically there was a point in time that medical offices could report folks if they suspected they were undocumented. Suspected, right? It's an ambiguous term. And they can report folks to formerly INS, USCIS now, immigration. So that says a lot about our state and how far we've come, right? CHIRLA has many departments, right? We have policy work, direct legal services, community outreach, education, organizing, and it's constructed that way because we can't do legal work without advocating at the state level. We can't do community education without direct legal services. So like my compañero was saying, it's multifaceted. We need coalition building. We need folks to get involved. I've been hearing, that's the same rhetoric I'm hearing from folks here on the panel. And when I was talking to folks too, we need everyone, all hands on deck. But to do that work, we also gotta take care of ourselves, right? A lot of folks depend on us, you all, to have their best interest, right? And the fact of the matter is, the second they enter an office, they've already gone through so much violence in their community. Like this is like a safe haven, a sanctuary for them when they enter the office, in your office, your network, your facility. CHIRLA was successful in advocating for AB 60, which is driver's license for undocumented folks. We also passed AB 1766, which is California IDs. It won't be implemented till 2027, but it's on the way. But it's being delayed because the DMV is gonna upgrade their system, right? They're doing their own updates, and we're doing the work, right? We're doing policy work, but also advocating. Now we got to share this information, right? So many undocumented folks still don't know they can obtain a driver's license in California. Like we're still behind, and that passed years ago. There's so much work to do in the community, and what looks ahead of us too. So much work to do. But yes, I forgot the question already.
That's okay. Thank you, that was great. Namsa? Oh, here you can.
Thank you. So Essential Access Health, we are a statewide organization that advances health equity and champions sexual and reproductive health care for all. So in our lane, I will say we need to protect and expand the protections that exist around sexual and reproductive health care. That means making sure Californians continue to have access to abortion, to birth control, to have choices. That means for young people, folks of color, our queer folks, with dignity, with respect, without fear, without stigma. It's important for us to counter misinformation because there's gonna be lots of confusing messages, lots of fear. So it's important that we are aligned in messages and helping folks understand what still exists, what's still available, because they may make assumptions about what they can't have access to. They may have assumptions about what they will lose or not lose and when that happens. And so folks that are on the ground in community need to be able to have the right messages to communicate to folks so that they know what they still have access to. You know, what's already been said is we don't know for sure what's going to happen, but we can anticipate what the playbook is going to look like. And so I think that's the other thing we need to be preparing for is a rapid response to what could happen. And what was also talked about is like the cuts are going to be deep, and collaboration and alliances are important across sectors, right? So what's happening in healthcare is also important in education, also important in housing, also important in climate. And if we stay in our little boxes and don't come together, we might as well just sit on the sideline and let whatever happen, happen. But this is an opportunity to be bold, lead forward, and really walk the walk. It is not the time to sit back and hold our hands and let something happen. If we want to see something different in California, then we also need to step up and do something different. And we got to do it together. And we have to have the hard conversations. And we need to be bold. And we need to come together in ways we may not have come together before.
I think I changed my answer to this quite a few times in contemplating it. And like the immediate answer is I think about helping to raise 2 teenage girls who will have significantly less access to care than I do at 47, right? Or even generations of us. I think about moving forward this idea of reproductive health. I mean, I came from working in HIV/AIDS in the 90s where we were dealing with abstinence-only programs, right? Like crazy rates of teenage pregnancy, and then we combated that, right, by looking at comprehensive education, sexual health education, integrating that into the schools, right, creating a dialogue, and we saw results in that, right? And then even when I think about immigrant health, I was at Northgate yesterday buying my stuff to make some caldo, and I did this every day during the pandemic when I'd go. And I look around and I'm like, how many of these people will be here next year, right? And we're all doing the same thing. We're cooking for our familias, right? Bringing our dollars, our hard-earned dollars, and trying to do the best that we possibly can. And we function together in a community. So when I look at the key concepts, it all comes down to really building a level of health literacy within our communities. And I think that's the highest priority because what came out of this election, and I see it in the ER all the time, is this diffusion of what facts are, right? And there are people who truly believe things that us as scientists or people based in evidence-based practice will look at them and be like, how do you believe this? And then there I am taking care of my patients, blasting away their Fox News in their rooms, right? Receiving a level of care that I'm providing with genuineness and kindness and, founded in compassion. And I listen to it and it's a lot of hate and disinformation. So I wonder if the most important thing we can do as a health policy is to counter that disinformation, not only with humanity and compassion, which I think we need to hold on to right now, but also with accuracy and information. I believe in this next generation. So I think one of the most important things we can do in the next 4 years is to build a coalition of the next generation of leaders in our health communities. So man, I'm tired of discussions around breaks in the pipeline for nursing and everything. We need to bridge that pipeline. We need to compound it. We need to build it. I want to see a whole new generation of healthcare leaders coming out in the next 4 years, because back in the world of when we were dealing with HIV/AIDS and discrimination in our LGBT communities. If you guys could see the physicians that are caring for our patients now with their pronoun name cards and things that are just innovative, that they can do proper pronouns and do provide care, and I see them at the forefront, that our medical schools are providing this. I want to see this come from our communities. I want our nurses to be from our populations, from our gente. You know, I'm going to be recruiting at Northgate, being like, mija, I want you to go to Santa Ana College, and I want in 2 years for you to have your ADN, and I want you serving on the front lines right next to me. I'm ready to train you and get you ready to do that. So I think that's the most political and prudent thing we can possibly be doing right now.
These are great comments. I touched in my slides the margins in the House and the Senate. It's unlikely that California, there are 2 senators, Padilla and Schiff, are going to be material in the Senate. But the vote margin in the House is very slim, 5 votes. So vulnerable Republicans, Orange County, vulnerable Democrats, Orange County, their votes might be very relevant in this. Unlikely that they can influence the package on a detail, but they can hold their vote. So one of the things that's important to message to your delegation here is how important healthcare is to the economy, this dynamic, vibrant economic engine in Orange County here that relies on immigrants. Healthcare is material for that. And that Republican members can't just knee-jerk accept what their party, they'll be under enormous pressure to accept what their party's proposing and to go along. And you need them to hold out. And similarly, Democratic members, there'll be enormous pressure for them to simply no on this, but there might be something where we need to engage. So you need to sensitize your members that there might be solutions here. We might be able to make the picture less dire there for the Democratic member. And you have to be able to say to your Republican members, if you cap the amount of federal funds here, we're all in a world of hurt. And that's not helping us here. So we might have to accept work requirements, but don't cap the program, as an example. As difficult as it is going to be for us to verbalize that and say that. So this is what I'm saying, activate your muscles. You have to get more, not get into the 24-hour news cycle, go down a level here. Get serious around details here. So I think that's the message I'd like to convey.
So Jonathan, keep the.
Oh, yeah.
Yeah, okay, we got it.
Next question is for you.
Okay.
So thank you for that. And you might have already, I know you did address this in your remarks, but specifically, given this administration's prior tenure, what key lessons or patterns should we anticipate in addition to what you stated, but particularly in their approach to Medicaid, public health, and addressing the social determinants of health that we've all in California have grown now accustomed to, right? When CalAIM came to be, you know, we at community health centers thought, well, finally, we can address the social determinants of health that we've always been addressing, because that is at the core of what we do as community health centers. We have community health workers, we have promotoras, we have enablers, right, that address the 90% of issues that patients walk in with to our practices.
Great question. Let me divide it a little bit. The health-related social needs, things that we call CalAIM, there are lots of states doing that today. There are lots of Republican expansion states that are doing that in different ways, in different versions, et cetera. I don't think the Trump administration is going to have objection to those programs conceptually, largely because at an economic level, you're just rearranging Medi-Cal dollars. So they're going to have an attitude, well, if that's what you want to do, rearrange, you want to buy air conditioners and not pay for doctor care, okay, we'll let you do that, okay? So I anticipate those continuing there. I'm using a kind of a loose example there. Don't hold me to that. But other things that we have to worry about is the capping the program, as I just touched on. There could be other types of restrictions put on the program, so we have to be really sensitized to those types of things. I don't see the CalAIM stuff on its face at risk here in terms of. I don't see them getting more generous. By the way, I don't see them getting richer and more robust here. But I don't see them going. I don't see them going away. I think they're baked into the equation.
Thank you for that. I was just asked to say something at 10:55, but I'll say it now. We're running a little bit behind schedule, so I want to get a show of hands of how many of you are willing to stay another 5-10 minutes to finish out our sessions. Thank you. Appreciate that. Okay, so Karen, or Karen, I'm going to call you Karen. Given the real fears many immigrant communities face around accessing care or signing up for health care coverage, fears rooted in policies like public charge and the threat of deportation, how can healthcare organizations, advocates, and community leaders build trust and provide support in a way that acknowledges these concerns while still encouraging engagement with with essential health services?
Thank you. Good question. Well, as you all know, Medi-Cal expansion just happened this year. That we were on the field advocating, sharing information, but now we're seeing folks disenrolling and having fear of, like you mentioned, public charge, which, by the way, public charge has existed for over 100 years. First, it was targeted towards Irish immigrants and Chinese immigrants, and now it's a tool for all immigrants, specifically if your skin color is brown, darker, much more targeted and much more fearful fears. And that's happening now. There's a lot of fear-mongering happening. There's conversations of mass deportations and Trump administration having this agenda of like the first 100 days, how are we going to mass deport, right? And even though it hasn't been implemented, people are still already talking about it. And we're already hearing conversations, and we hear the media, like, don't get me started on the Spanish media. That's all they talk about every single time, right? So folks I was talking about this earlier during the networking period. Folks are already disenrolling. They're fearful. With fear comes anxiety, depression. Statistically, immigrants are more susceptible to mental health issues because of those things. So how community education in Orange County is kind of fighting back, resisting, is collaborating with the family resource centers, clinics. We're having workshops on public charge, know your rights, and we're also incorporating healing also. How can we take care of ourselves and process the information, but also have access to the right information? Who do we go to, right? And also that brings up the conversation, like, who do we go to when ICE knocks at our door, right? We're not gonna call the police. Who saves us when that happens? So there's rapid response networks in place in Orange County that can support. But for public charge, we've been collaborating with like local organizations that are able to, we can do a handoff. Like, oh, there's a community member. Okay, here's the information. Let's provide this information. Here are the facts, right? There's folks that are residents and are thinking about public charge. And if you're a resident in the US, you're not susceptible to public charge, right? If you want to become a citizen, you don't go through the public charge rule. It's actually only for certain immigrants going through the consulate process. It's not even for everybody, right? If there's folks that have humanitarian visas, doesn't even affect them at all. But it's the misinformation that we're hearing that we see folks disenrolling. After fighting for Medi-Cal expansion for all, now we have to fight, to give correct information about public charge. So it's a conversation and dialogue that has to happen. Just collaborations with a lot of nonprofits that are doing public charge work. But yes, Trilla is on the ground, but of course there's only a few of us on the ground. The impact is much greater. And we also have Trilla TV. We're on TV on Saturday mornings. We have TV, we have a show, we have Facebook Lives that we talk about these issues too. It's about getting the information. We have flyers that have and can provide this, but in general, as folks that are here in this room, even attending a workshop and knowing about public charge and just giving general information and hope and not fear, just the first step, us being aware of what is public charge, well, who does it affect, us being knowledgeable behind what public charge, how it comes from, what it is. It's really meant to attack a lot of immigrant folks. A lot of immigrants are not even under a public charge rule. To receive the benefits that the government is talking about, you have to have status. Undocumented folks already don't qualify for those programs. So it's just fear-mongering overall. But it's super important to be aware of the facts and always ask, because community members come to me like, well, I heard like this rumor and this señora that told me, like la vecina, the neighbor told me. It's like, no, like, you know what? All of us can get involved and organize, and there's a place for everyone at whatever capacity you have. You don't have to be in the front lines protesting and getting arrested, You can be in conversations and just or be in conversations with organizations that have the facts, the information. You can just, even by being an ally and providing correct information, is you helping, is you organizing, is you being a part of that. You don't have to, be in the front lines all the time. So, thank you.
Thank you for clarifying that. I think immigration questions have probably been the hardest for us to address at community health centers because we're not lawyers and we can't necessarily state something and guarantee that what we say is true, right? And so I think what you pointed out to is education and partnering and making sure that we at least have all the facts straight and maybe partnering more with your organization and legal aid and all of our partners that can bring legal review to the table so that we're not put in a position, right, to maybe inadvertently add to the misinformation or disinformation. And I know that we don't do that intentionally ever, but sometimes because we're not attorneys and we can't guarantee the responses, sometimes we refrain from even addressing it. So thank you for bringing that up. So let's see, Betty, on to you. So from your perspective, how will shifts in healthcare policy impact the delivery of care on the ground, and what role can advocacy play in bridging gaps between policy and practice?
Yeah, on this one, I really think about my role in my organization at the National Association of Hispanic Nurses, and in really committing to being a public health nurse and working in the ER. Part of ACA was like really mobilizing the role of nurse leaders, right? Really expanding this idea of the nurse as an advocate and engaging in the communities, being a key player in addressing the social determinants of health. The Future of Nursing campaign is really looking at this broad scope of expanding health equity, with nurses at the forefront of that. So I'd be remiss to not say that we play an important role in addressing the health policy changes that are going to take place acutely now, and I think through this administration. What we know with administration changes is that the pendulum swings, right? So we're going to hit an extreme right. People thought that this would bring change, which would include increase to access that was being deprived of them, right? That was the rhetoric that was given to them. And we're going to see changes where I see it on the ER level all the time. People get into traumas, have accidents, become sick, and whatever entitlement they thought they had suddenly changes when policy doesn't match up to providing them the resources that they thought that they were supposed to be getting. And it's not the immigrant communities who are having this expectation. I can tell you that right now. It's my 42-year-old male in Huntington Beach who was drinking while driving, while riding his bicycle on the boardwalk in Huntington Beach. So, and all of a sudden, totally surprised that he has no insurance and a very, very expensive ER bill after his visit with us. So those are the kinds of dynamics that we deal with. But I do also deal with the immigrant worker who was hit by a car on their way to their restaurant job, right? With major trauma to their body, complete disfigurement or disability. So how do we provide a network of support for that? And I think we stand at the forefront of expanding where we can provide education and resources for our nursing population. I'd love to see more of our nurses have an opportunity to become educated at our community health centers. I mean, there is a very difficult ability for our nurses to get trained out in our community, right? It is one of the most, ask any nursing program in this area, and they will tell you that the biggest charge they have is being able to get nursing students into a clinical placement, right? As an educator, I see this as a challenge. So we need to find innovation in being able to expand how we educate the next generation of nurses in our communities. And we need to be able to do it outside of a hospital setting. And if our clinics can open up an opportunity to provide that direct care for our nursing students, who will then become the nurse leaders in our community clinics, then we need to find the innovation to be able to do that and allow for nurses to be part of that response to this critical need that's going to continue to expand. And I know it's difficult. I know it always comes down to an issue of liability and who's going to do the work, but we need to stop asking the question, who's going to do the work, and just roll up our sleeves, put on our scrubs, and get the work done. Don't you guys think? Yeah. Let's do it.
Thank you, Betty. Always roll up the crowd. Okay. So Namsa, how do you anticipate reproductive health policies changing in the short and long term, and what steps can healthcare providers take to mitigate challenges?
Ooh, that is something, that's like of course you give me that one, Isabel. I would say, let's say short term or immediate, there will be attacks and challenges to medication abortion, right? So it will be challenges to the medication, and a chilling effect to probably enforcement, right? So then creating fears of providers, and access, right? So folks being able to get medication and the method and the kind of the process of it. So most abortions are done through medication abortion. Mechanism is telehealth. So that can create a challenge. And then I think on a long term, I'll use the example of Title X. So Title X is the only federal program solely devoted to family planning with a priority to folks with low income. Trump 1.0 really took an opportunity to reshape the program in terms of the program rules and expectations with how the program was delivered. So we had what folks refer to as a gag rule, which didn't allow providers to provide abortion referral or counseling. So it really put providers in a position to really not provide full information to the patients that walk through their doors. And it also required them to forced them to really direct patients into appointments and care that they may not have wanted. So we can anticipate that will happen again, but to even more extreme expectation. I think we can also expect even more parental involvement and probably a mandate for parental consent and involvement. Right now, it's just encouraged. But we can look at other cases, like there was a case in Texas, and there's other things that existed, so we can see that they were probably, or anticipate that there will be even more of that, because they want to they haven't talked about getting rid of Title X, but they have talked about reshaping the focus of Title X. Under the Biden administration, it had really become a program talking about equity, access, and quality. Under Trump 1.0, access was never mentioned, quality was never mentioned, and equity was never mentioned. So we will assume all of those things will disappear under a Trump 2.0. You have what they call a DASPA, Deputy Assistant Secretary of Population Affairs. That is the person who oversees the Title X program. Most likely, they will have someone who is anti-everything run that program. It will then probably become a program that is abstinence only. Talk about family with a man and a woman only. Anything that is related to openness to anything other than something with a man and a woman will probably not be discussed or talked about. And so that is what we can expect or anticipate in a new Title X program. They will probably want to expand or change who is allowed to be a provider in Title X. Before, they tried to eliminate Planned Parenthood being a provider. They weren't successful in doing that, but some Planned Parenthood affiliates decided not to participate. They'll probably try to push that again and have providers that are not really providers. So you may have heard folks talk about crisis pregnancy centers. So those will probably be the folks that they want to expand to be in the Title X network. So those are folks that don't provide actual clinical care, and also folks that provide misinformation to patients that walk through their doors. And so those are the things that could exist in under a new administration and what a new Title X program could look like. And so what does that mean for California? So our organization has been the Title X grantee since the inception of Title X over 50 years ago. So that could mean we may not be eligible to even be the grantee, because not only do we administer the family planning program, we also administer 3 abortion access programs for the state. So they may put limitations on the type of grantee that could actually be part of the program. So as an organization, we have to think about, what do we do to be creative to still maintain and be eligible to apply for those fundings? Because now we're probably going to have more competition than we've ever had before for those funds. And so that will go back to what is going to be the state's responsibility, or what is the state willing to do in terms of backfilling when there's losses. I think Jonathan and Francisco mentioned that. The state stepped in before, and I know the state will be stretched in lots of different directions going forward, but those are the things that we anticipate and we'll be having to solve for and figure out going forward.
Thank you, Lamsa. I thought you were going to bring us good news, right? didn't you state that? So thanks again so much. We recognize that that just makes our climb uphill, longer and harder. But again, as all of our panelists have stated, if we band together and continue to collaborate and bring all the resources we collectively have to the table, then we can combat, these issues. So I've started to see a couple people leave, and so I want to bypass the rest of the questions that I have for the panelists, because at some point they've addressed them or answered them. I want to turn over the opportunity to any questions we may have from the audience.
For Health Career Connection. I appreciate just all of you and everybody in the room. In educating all of our constituents and in hearing the depth of what everybody is presenting, I believe in the total community engagement that's been discussed, but I also think it's important to be kind of brutally honest. Like, this is what people voted for. Mm-hmm. And so breaking down, like what you just talked about, our funding could be at risk, or we are, at risk of being a provider for Title X. I think people just need to know that. And I hope it's been framed speaking with our legislators locally. But during COVID, I think the National Governors Association did a good job of running dashboards for things. And so I'm hoping that perhaps in the strategies that some of you all have talked about what you're producing for constituents, the National Governors Association kind of can give a dashboard for what that means around the country so that people really understand this is what you voted for. Because I think to create the change we need, there just really has to be kind of brutal honesty. And I appreciate saying we need to stay positive and come up with these solutions, which I think is true and we need to share. But if we know this depth in the background and we're just kind of saying this is what we're doing, I think people are missing like, hey, no, I voted for this, and all these people, you know, the data is saying by voting for Trump, it's going to take you, all of us, our resources, X more, our time, effort, and everything, when if your vote could have been something else, we could be this way. I just think giving people strategy, so I hope that collectively that could be really part of the strategy, is being honest with our constituents and voters.
Thank you for that question. I want to speak to that. In listening to the panelists, one of the things that stood out to me personally and reminded me of when I first went to college. I grew up in a very segregated immigrant community of farm workers in the Salinas Valley. At a time that was very rural. It's not as much anymore. And when I first went to college, I didn't know how to talk to people, including my professors, because I grew up in a mostly Mexican immigrant community. And then I learned code switching. If you all heard of that, right? It's when you have to switch the way you speak in different communities. Your comments make me think about that, and the comments of the panelists, right? Jonathan and I were talking about some of the political dynamics. And in California, I think the brutal honest piece, right, will be talking to certain communities, certain electeds about the honesty. And then when we go to DC, when we're trying to protect the resources, we might have to code switch and talk in a different way. That's the way I think about it, right? Depending on who the audience is, when we're here in one space, we're going to talk a certain way. And in different spaces, we just got to be very strategic. And in California in particular, it's going to be challenging, right? Health equity is important to us. It's going to continue to be important to us. And I might frame it a different way if I'm talking to a certain member from a certain district in DC to protect the programs that are essential for us. That's what comes to mind when I think about what you're saying. And I do think it's really important to remind people there's something happening and we got to listen to it. Jonathan was telling me this fact that 400,000, is that the right number, in LA, additional voters voted for Trump in LA. Why? Right? And we need to understand that to be able to speak to them, to address the issue. We can't just ignore it.
I just want to add to that, Audre Lorde said, without community, there's no liberation, right? So I resort back to my Chicana feminist, training to say that we need to create a new community in the light of the truth that we are standing next to people who are diametrically opposed to how we think and feel and are overtly being given permission to speak to that, right? And engage in that, and in fact, vote to that, and now are the majority. And so it's important for us, I read somewhere, we don't have to break down, we just have to break through, right? That is what we need to do. We need to hold on and survive this and create a narrative that speaks to who we are, because we weren't overshadowed, right? It wasn't an overwhelming win, right? We stood side by side in arms, fighting to the very last moment, to the very last ballot, right? But we do live here in Orange County where it was pretty tight. So we need to be ready for that narrative and to build that community. And everyone reached out to me after the election. They said, "Are you okay?" And I went somewhere and they said, the best thing we can do is experience joy as an act of resistance. So let's be joyful. Let's be full of health and beauty and wonder in our communities. And let's go out there and kick some ass. I know you said to be nice about our language, but I don't think we can do anything but go out there and kick some incredible community building ass. What do you guys think? Let's do it.
I don't know what I can say to top that, but again, I think to the question about being brutally honest, there are going to be certain rooms where we can be brutally honest when we're amongst friends, but the code switching, I think also I resonate with as well. But I want to remind us that we didn't just come on board doing this work like last year or during the Obama administration. A lot of us have been doing this work for decades. We grew up with this. Again, I mentioned the trauma earlier. Sometimes that trauma carries us forward, and we've gone through the full pendulum, swing forwards and backwards, and we've done an amazing job building relationships in our county. And the Republican leaders, I can say, are our friends in our county, right? We've made significant strides building those relationships, having bipartisan support for what we do and who we represent, and we just need to lean in and continue to build off of that, because at the end of the day, I think we really do care about the same issues. It's just how we frame it and how we can help them sell it, right? Because they want to get reelected as well. So how do we make it possible for them to do their job by helping them do ours? We have one more question? Okay, go ahead.
Good morning. My name is Dina Esquivel, and I'm in the health insurance industry. I'm a health insurance broker. I love the conversation that you guys are all having here. I meet with the clients when they come in and they ask for insurance, health insurance, when they're asking for Medi-Cal. You're absolutely right. Now they're pulling back because they think that they're going to be deported. Now that we passed the law here in California where they can actually access healthcare services for Medi-Cal, now they're saying, let me take a step back because now they're going to know where I am. I actually have a client, and I'll share the story very quickly. He was deported. He came back into the country. He came in because he needs cataract surgery. If he doesn't, of course, you know the results of that. But he came back to me because he received a letter saying that they needed a MC-13 form, and he said, I'm not going to fill that out. I'd rather go blind than filling out that form because they're going to find out where I am, and then they're going to deport me. Yeah. So that's what the things that are facing. So my recommendation for all of us is, for me especially, being in the front and helping these people, is to have these conversations with us as well, because we need to know what kind of resources we can offer them and where can we send them so they can get the help that they need. So I'd like to get your card, so maybe we can set up something later on. Thank you.
Thank you, absolutely. We have another question.
Can I say something?
Oh, sure.
I'll be quick. And Karen's comments remind me of this. The legislature is trying to figure out what can they do in this environment, and one of the issues that's come to the top in California is the privacy question, right? If I access resources, are they going to get my information, especially for the newly eligible? That's a top priority, and what I'm hearing here today is we got to prioritize getting that out. I'm going to the Latino Caucus meeting later today. I'll bring that up, but I think it's top of mind already. I'll give you my card also, because usually what drives our stories like that, they need to hear from us. That's a perfect example. They got to hear the reality, and then they can respond to give that assurance, because I know that's a top concern. It's a legitimate concern.
And so many folks don't get medical care for fear of deportation. And I always, when I'm in the community doing workshops, I'm like, okay, there hasn't been an immigration reform in 35 years. Public charge, if at any point you are a public charge rule, it's meaning that you're dependent on the government. But having cataract surgery for one moment, 6 months, a year, is not dependent on the government. Lawyers can frame a case to make your case look better, right? Okay, at one point in time, they were dependent, right? But that wasn't permanent, they weren't there for decades or years, right? So, and that's up to the client too. We can't make those decisions for them, right? But it's just something we see in the community, like folks are not getting medical care because they're not getting cataract treatment. You know, so many folks didn't get COVID treatment for the same reasons, and immigrants have the highest numbers as well for not receiving medical care. But that's just an example of the fear of public charge, and it's like, I always tell folks, like, well, I try not to say it on camera, but like, so many folks don't get their cancer treatment. You know, they die waiting for this immigration reform that is, we're far from it right now at this moment. You know, it's like, do you want to survive and keep waiting, or you die trying, you know? Like, it's just that conversation we have, yeah.
Talk about brutal honesty, right? So a question back there. She had her hand up first.
Sorry about that, everyone.
Competition.
We're nothing if not
Okay,
fair.
thank you for the exercise. I appreciate that. So, Kalita Gardner from Health Equity for African Americans League, also Second Baptist Church, where we're building a wellness clinic. Oh, yes, praise God. So I want to piggyback a question in regards to, you talked about privacy, but data has become a big issue, especially in the Black community, how that's being shared and utilized, and who owns my data, et cetera. So there's the real fear in the community around data. So if you could speak to that. But also, Jonathan, you spoke to going a little bit deeper, staying out of the 24-hour news cycle. Could you share some resources for those of us who don't live in the insurance industry, new to the healthcare world, but desiring to provide accurate information to our communities?
So we'll start with Kim.
Surveillance we're seeing with communities of color specifically. Big Brother, you know, that's something CBP, Border Patrol is exploring a lot more. A lot of immigration organizers are learning about how we can draft policy to protect folks. A lot of activists too are at risk. They're like on the FBI risk as well. It's still a conversation to have in California, and I think we're going to see that a lot now in this new administration. There are organizations doing that work as well, and I think that's important to collaborate so we learn more, because it's going to affect all of us personally. You know, AI is coming in too, listening to our conversations. How can we have these, you know, how can we organize them, but they're listening, you know? That's something to explore. I don't have the answer to that as well, but I think policy, but there, I would direct my attention to those organizations that are doing that work as well. Yeah.
What I would add to that too is look to who in our traditional coalition networks has had to do this work. Mm-hmm. What comes to mind, I sat on the board for Planned Parenthood Mar Monte for a long time, and in the abortion space, right, the data and the privacy of that data has been life or death for a long time, particularly in other states, not so much in California anymore. So the investment in like cybersecurity and data privacy, and they even ran a bill last year, I forget the name of it, to pull away the abortion data out of the traditional EHRs because of concern of it getting out and being used in the wrong way. So I think we should look in spaces like that, but it's a good call out. I think it's gonna be really critical during this time. The state's starting to do that work too. That's part of the work that they're doing behind the scenes, is how do they protect their own data, and are the federal government gonna try to get their data to impede the work that California's expanded?
Your comments about, I mean, the immigration question, a lot of dust has been kicked up. A lot more dust is going to get kicked up, and we don't know how it's going to settle, okay? There will be legislation that makes immigration laws tougher, more intrusive, and if it gets to the president, he'll sign it, okay? That's going to happen here. What does the Trump administration do there's a lot of discretion in immigration enforcement. Not everything's set in law. Just like in our local policing, there's a lot of discretion in whether an individual police officer pulls somebody over or not. We can object to that and have all kinds of questions about that. So I anticipate a tougher, less stingy, more stingy, more aggressive immigration enforcement. How much health information can transit that? We don't know. We actually don't know that. So the concerns of mixed status families, the concern of an undocumented is a legitimate concern. We also don't know how protective, despite the desire of California to want to establish protective features, we actually don't know how strong that protection would be. Okay? So we're in a very murky period here. We have to tune in very closely, National Immigration Law Center, to understand the rules of the road so we can advise people. They're thinking about these very things right now, okay? On the health policy questions, Kaiser Family Foundation, you need to subscribe to their news service. It's free. You need to go to their website. They're tracking all the health issues in play here. Very digestible, usable. Center on Budget and Policy Priorities, a think tank in Washington. There are also important resources. We don't, the Medicaid ones, we're going to have a stingier, tougher Medi-Cal program. Whether California backfills it, we don't know, okay? The questions that NAMSA raised around, just like I mentioned in immigration, in reproductive health, that's a big unknown area. Is Title X going to be clamped down? Is the Comstock Act, which is access to over the medications, is that going to be restricted? We don't know that. That's why I said at the beginning here, you cannot tune out here. We have to become more knowledgeable about these things and be able to translate them, because Francisco talked about the elected officials. They don't realize how much on the front line they are on these questions, okay? And we have to simplify these arguments, because the overreaches, the potential to overreach here is great. Are they really going to shut off access to contraceptive? I don't think. You saw all those blue counties that want health care, even for low-income people. That's Prop 35. On the other hand, we're the electorate, sizable chunks of our electorate, to our colleagues' comment here, voted for this, okay? So we have to understand this tension that's going on here, okay?
Well, and it's not the first time we're here. I mean, in HIV/AIDS, we worried about, that being out and available to people, like status being known, and we had to do legislation around it. And in Prop 187, what created nurses to respond was that we were being asked to report our patients. And that led to one of the largest unification movements that I've ever seen in my life, as we all drove down to LA, and I looked around and I was surrounded by the Filipino Nurses Association, the Black Nurses Association. All of a sudden we had this partnership of nurses saying, this isn't what I'm here to do. So I'm calling for all of us that are not here to do this to continue to raise our voices together in collaboration when we think about what's at stake. When we show up to do the work that we're here to do, if this isn't our call to arms, then that's when we have a united voice, whether it be in support or loud or quiet or code switching, whatever it is. We aren't here to report on our patients, right, when regarding their legal status. So I think that we have historical movements to look at that we can learn from and do better with, and we need to look back in order to look forward, for sure.
I just want to say something just really quickly. We have to connect the dots, right? Because one issue leads to another issue. So there's going to be kind of this patchwork. So, we've talked about data and privacy as it relates to status, but there's other reasons to be concerned about confidentiality and data. And so I think those are the things where we have to think about how we connect the dots. So yes, the example in terms of Planned Parenthood is a good one, and we have to think about where are the other places where that has come up where it's been in terms of whether it's HIV or criminalization, wherever you've had to have some concerns about what people know about you. Any of those things is where you got to start to think about live scan. All of those things, we have to start to connect the dots, because folks of color are going to have questions for all kinds of reasons. So we have to just pay attention to what's happening.
Thank you. We have 2 more questions, and then we're going to close off the questions back there.
Hi, good morning, everyone. My name is Trinidad. I'm a medical student at UC Irvine, and I'm here with my colleague, Melanie. She's from UCLA. Very, very just honored to be here. I never thought I'd be in these types of spaces. And also, I'm very nervous when it comes to speaking, so sorry if my voice cracks. But I just wanted to, thank you all for being here. Melanie and I are part of a coalition of the larger Prime statewide. We both are enrolled in a program called a Program in Medical Education. I'm in the Latino community, Prime LC at UCI, and Melanie's in Prime LA for Leadership and Advocacy. And what we are trying to do is we're trying to ignite this fire in medical students who are passionate about physician advocacy work. Because we are, trained to be physician advocates, we want to really define what that means. And the key takeaways from here and previous conversations is that advocacy begins simply with a conversation. It's not always at the state capitol, or in Congress, but simply just even being here. And so my question is a 2-parter. 1, how can our coalition be part of a larger conversation like this one, where we can invite you all into our spaces, such as the medical school or Prime programs? We have a Prime statewide conference coming up in February 7th through the 9th, where we'd love to have you speakers come through, or anyone here, to just share your knowledge about, again, how our medical education can shape our future as physician advocates in these types of spheres. So that's part number 1. And 2, it's more of a question of a personal curiosity. So in my clerkships in 3rd year, I did my emergency medicine clerkship, and that's where I mostly saw the impact of healthcare and coverage. And what I noticed is coverage doesn't always mean better health, right? It comes down to the social determinants of health and the preventative care, of course. So with these new changes potentially happening, healthcare coverage being one of them, what can we expect to see on either side of the pendulum with healthcare coverage, whether that means catch-up diseases, meaning people are now getting medical expansion and therefore going to their primary care office to treat these chronic medical conditions, or people who don't even know how to access their primary care insurance even though they have health care. So what can we expect to see on both sides of the spectrum with healthcare insurance? And also, how can we collaborate? Thank you. Sorry, this is a long-winded answer or question, but thank you.
Well, I can address the collaboration, maybe both of them, but the collaboration, I just want to say done, right? All we have to do is connect and partner. I was just all giddy up here saying, yeah, UCI, they're here. I know who's responsible for that. So thank you for that. On the care and coverage, right? We want to make sure that we continue to do the education with our patients at the community level about understanding what their insurance coverage is. First of all, how to get it, and then what to do with it. I wholeheartedly agree that coverage doesn't necessarily equal access or quality, right? There has to be an intentional effort to get us there with our patients, and we focus a lot on that at the local level and at the statewide level as well, because we recognize how important that is.
To your other questions, about how to frame this, I would urge you to think about how to reframe healthcare in Orange County. And this, I want to go backwards to how the safety net was framed in Orange County 30 years ago, was that it's material to the economic engine of the county. Okay? It's less about an individual right to healthcare, even though we all agree with that. Not everyone agrees with that premise. You have 5% unemployment, okay? You have this vibrant, dynamic economy here, and the safety net and healthcare. First of all, you cannot divorce the safety net from the rest of the healthcare system, okay? Because people show up regardless of insurance status in the ER. I remember a world before EMTALA. It was very different, okay? It was very, very different. So I think making the connection that healthcare underpins this vibrant economy in Orange County is a critical reframing that has to be done here. Your larger question is what's going to happen? If the feds turn off the money and say, California or states, you only get this much Medicaid money, we'll have a very difficult debate. Okay, that's what I meant is like, how much does California backfill? It will be schools versus everything else. Okay, that's going to be our fight. And do we roll back the undocumented expansion? Do we have a skimpier one? Is it time limited? That's what could happen here. We could be in that type of environment in California.
And I think that's where we have to realize the state is not the only response to this, right? It's like this is where the state, foundations, other private this is a statewide response to a large problem. And, you know, I kind of jokingly say, how do we Trump-proof strategies in California? Because I think that is the lens we need to be thinking about for what we do here.
I'll make a quick plug because I spent 17 years of my career working at the California Medical Association. So to your first question, I have to address it. Isabella answered the first, like, just ask. I'll go. To Prime, and we're doing work on the physician supply, specifically focused on Latino physicians and others of color, because it hasn't grown. So a lot to talk about there. And then on the other one, I would encourage you to continue to show up in these spaces because your voice is super impactful, not only physicians, but the other clinicians, hugely impactful. And the traditional established associations struggle they know they need that voice, so they struggle to have it. So if you show up, you have a huge impact. And I would think about it that way, not just starting your own things, but taking those existing organizations that they're like 200 years old and they invest millions and millions of dollars in advocacy. If you go in there and organize and make sure they invest the money in the things that you care about, that's hugely impactful. If you do that, and don't think that you can't, you totally can. I've seen it done, particularly in the medical students. So thank you for being engaged.
And I would tell you, of course, the partnership begins with your enfermeras right here. National Association of Hispanic Nurses will gladly collaborate with the Latino physicians. I think if we look from macro to micro, the most impactful moment in my life is when I get to walk into a patient's room and say, hola, voy a ser su enfermera ahora. And right next to me is mi doctora, saying, buenos días, señora, voy a ser su doctora. I've had that opportunity very rarely, and I cherish it. So I would tell you that while taking on and embarking the role of advocacy, the most potent thing that you can do is survive your education at this point. Continue to thrive, become a physician, and stand next to me in a couple of years ready to say, buenos días, señora, vamos a ser su equipo médico ahora. And I cannot wait for that moment, Trinidad. I look forward and I welcome it.
We need my doctor.
Yeah. Dr. CK, your last question.
I just want to say thank you for really hosting this. So as a health officer, I didn't realize what my job really was, right, for a long time. So I was a family physician seeing patients at the heat of COVID. And it's when you go into times of struggle where you have to think differently. How am I going to solve and care for my community, my people, my family, right? I think this is that time. This new administration opens up an opportunity that you all just shared with us. Yes, there's negativity and there's concern and there's anxiety, but there's also, again, positivity. And I came into being a health officer not even understanding politics, but let me tell you, it opened my eyes being at the Board of Supervisors and understanding how to navigate, right? Talking to people who think differently than you, right? And dealing with a community that thinks differently. I'm now in a home that we're just divided. And I actually honor hearing the other side because it helps me gives me perspective of, well, I've got to look over the entire county, and we're 50-50 now. Yeah. We're purple, and I've got a board of supervisors purple, right? How do I talk to every person in code switch appropriately in the right space to connect? It's all about connection. So if we think of how we connect with patients, it's learning how they are a person. Our community is a person with a heart, with a story. How do we help them have a voice in the right setting so their story is told in a way where politicians and legislators can make a change that affects them? And I think that's what we all need to learn. We need to civically engage, get more people engaged, and say, hey, you're struggling? Well, let's all make this better. Let's get your voice to be heard at the level where it needs to be heard. And I think as we get together in these sessions and we learn how to speak for our community, then we'll impact change in a way that's beneficial. So thank you.
Thank you so much, Dr. CK. And for those that don't know, Dr. CK is our public health officer for the county, and she's been a great champion ever since she came on board. And we don't tell you that enough. So this brings us to the conclusion of our Coffee Connections event. I want to thank our esteemed panel. We had, I think, a more robust conversation than I thought we could have, again, given the space where we're at. I want to thank you so much for joining us. Again, this is our first in-person event, and I don't know that I'm going to be able to convince our staff to go back to virtual, given that we've had such a great response and turnout. So I welcome you to make the connections, right, that you came here to make. I saw a lot of networking early on. I see a lot of old friends, but I also see a lot of potential new friends. There's a lot of questions about how do we do this work now going forward, and I think we do it by getting to know each other, getting to figure out what corners of our county and our state and even in the nation can we partner together and pull in our resources to really do the big lift that's ahead of us. So thank you all so much. I do believe, let's go off script here. Our next Coffee Connections is on February 28th, 2025, and it's going to be focused on the first 100 days, navigating healthcare priorities and opportunities in the new administration. So this is not the first time we're going to call out the uncomfortable truths, right, and be boldly brave about calling out what it is about the new administration that we want to address and work on. We're going to continue to monitor this until we get the solutions, right, that we strive for, even if it means being pitted up against other entities and other programs. I think we need to just focus on doing what we need to do to make sure that what we've gained, we don't lose, but potentially even grow what we need to in order to get to the optimal state. So thank you, everyone. I really deeply appreciate you staying more than the 5 and 10 minutes I asked for. Thank you so much.
Sí se puede, everyone. Sí se puede.